One early morning at a hospital in a tiny town no one knows about, a patient wanted to get out of bed and ready for the day. This patient had an injury which deemed her non-weight bearing, therefore the nurses had to use a hoist and sling to safely transfer her. Once she was dressed in her favourite outfit, the hoist and sling were used in order to avoid any harm for both the nurses and the patient from poor manual handling. New South Wales Health, local district Murrumbidgee, developed a policy that outlined the procedure of how to safely transfer a patient from one location to another using a hoist sling transfer. In the scenario used, the patient had an injury that provoked the use of the hoist in order to protect her and the nurses. Other factors that can trigger the use of a hoist sling transfer are musculoskeletal injuries and the exposure of blood and body fluids. The policy is developed by Murrumbidgee Local Health District in order for the safe transfer of patients, but has also implemented work health and safety policies. New South Wales Health 2013 developed a better practice procedure under work health and safety that outlined that it is the health facility's own responsibility to source out and undertake risk assessments on equipment in order to determine if it is fit for use in their environment. In the years 2013 to 2014, there were 6,370 serious claims of injuries that occurred within hospitals around Australia. In saying this, a number of state governments have developed their own policies for the safe handling of patients in order to minimise staff injuries from manual handling. Academics also contributed to the evolution of mobile hoist lifters after the failure of educational programs since a mechanical lift has been introduced. Since the introduction, there has been a reduced number of injuries within nursing personnel at hospitals and nursing homes. As a student, it is daunting to first see how and why lifters are used, and then be expected to learn immediately. When using the hoist sling lifter, it was not noted who decides if and when the patient becomes a sling lifter. Can it be a nurse, doctor, or is it a physio, or do we all work together? They also did not mention how regularly the patient should be reassessed when using the hoist sling lifter. Noted by WorkCover Queensland, a patient should be reassessed on a regular basis when a notable change to physical and mental status has occurred. There are also a number of pinch areas on a lifter which aren't mentioned on the policy. This could also help professionals to not place their hands near these areas, but to be able to also guide patients' hands away from the areas as well. In making this digital story, I've learned that local health districts develop their own policies for manual handling tasks such as hoist sling transfers. The introduction of these machines has been the result of a reduced number of serious workplace injuries that frequently occur within the nursing profession. Although the continuation of information and research is needed to ensure we have a great understanding of the benefits these machines can give.